Problem that sometimes we have with glaucoma patients, and why a good number of them don't report on time, is that it starts with peripheral loss of vision at the periphery, not the central. So there is always a closure of vision until what we call barrel vision, tunnel vision set in.
Welcome to Impact Your World. Glaucoma is a disease that damages the optic nerve and as a result can cause blindness in persons with the disease. According to Dr. Buchi Ibiam, early detection and treatment can preserve a patient's vision but cannot restore any vision already lost.
It's a series of eye problems. Let me start it that way, right? It's a series of eye problems that most of the times will lead to a damage to what we call the optic nerve, right? So because of that damage in the optic nerve, people that have that glaucoma and it's not diagnosed on time, it's not managed on time, their vision will try to progress, go down until they might not see at all. The intraocular pressure in the eye, sometimes it might be associated with that. But ultimately, it will lead to a damage in the optic nerve head, right? And so then a loss of vision.
What is the role of the optic nerve?
Right. Now, when we look at things, as I'm just watching you now, right? The image, there's a reflection that pick the image. The image comes straight, right? Enter into my eye, move to the retina. The images are formed on the retina, right? When those images are formed on the retina, they are moved to the optic nerve. Then the optic nerve will pick those images, move those images to the brain, right? The brain will interpret that and tell me that this is what I'm watching and send it back. So now the optic nerve serves as a conduit, as a junction that conduct the images from the eye to the brain. Now, in the case of glaucoma, right? When this optic nerve is damaged, like something like conducting them is damaged, even though the image is formed on the retina, the patients cannot see it because nothing will be moved to the brain because it is the brain that will interpret it and tell you actually that you are seeing. So that is majorly the work of the optic nerve. Pick the images, send it to the brain, bring it back to the retina. Always a continuous production of what we call aqueous humor in the eye, right? It's what steady the eye and give it the shape it is. Like now, if something punctures on someone's eye, a fluid will come out, right? That fluid is produced within the eye and it's also drained within the eye. Now, imagine a situation whereby that fluid, the drainage is blocked. You understand? It means that the fluid, there will be excess of it in the eye. There will be a buildup of that fluid. Or a situation whereby the drainage, that's the filtration angle, is narrowed, right? There will be a buildup of that fluid. So that is what we call the pressure. It will mount like a pressure. Now, that pressure will push forward to the cornea, the black eye, the white eye you are seeing, and we should push backwards. In most cases, right, when you push forward backwards, the cornea will maintain its shape, it doesn't budge, understand? But the inside, at the back of the eye, it will hit on the optic nerve, right? There are still a lot of controversies as to why it causes a damage, but generally after that, after some time, the optic nerve is a little fragile because it's hitting there, it's mounting pressure on it, we start damaging over the time. Especially when there is a history of blindness in the family. Try and run eye tests. Now, if you run eye tests and it's detected on time, then it can be managed. If you don't have any condition that has to do with eye, if you are reaching certain age, maybe if you are reaching up to 40 something years, 50 years, make sure from time to time go for an eye check.
According to the data from the Ministry of Health and Wellness, persons 50 and over are more prone to getting the disease. As this is our last show, we would like to thank you for inviting us into your homes or wherever you may watch this show. Also, we would like to encourage you to be on the lookout for more shows from Climax Production. Remember, let us all do our part to make this world a better place. No kind act or deed is too small or insignificant.